People who exercise can lower the insulin resistance back down to the normal sensitivity.
Really? So it's reversible?
Yes, definitely reversible, but it may not be reversible in later stage of a disease stage such as diabetes.
Oh, I see.
So that's why it's so important to have a preventive strategy.
Well, welcome to the SpeechSage AI in Healthcare podcast. I'm Noah.
Dr. Yoon.
And I will be presenting today, and we're hosting with an in-house physician. And we have some questions for you as an in-house physician for a lot of people, just a general, specifically around the topic of insulin. I think diabetes and insulin resistance and a bunch of different things around that have become a topic of mind for a lot of people, especially in America. And yeah, there's a lot of questions about that, and I'd love to learn more. So I guess the first question is that people hear about a lot is, what is insulin resistance? Like, what does that even mean?
Yeah, insulin resistance. So how I got interested in insulin resistance is as a person who worked in hospital system a lot. You get a lot of sick people coming in with a heart attack, stroke, and cancers. When you look at all these different disease states, I come to realize, wow, so high percentage of what I take care of at the hospital stems from low-grade inflammation that has gone on for many years.
Okay.
And that leads to blood coagulation issues, leading to stroke and heart attack. And then that low-grade inflammation causes alteration of genetic materials and leading to cancer. And then that low-grade inflammation, when it affects the brain, it causes depression and other psychiatric disorders. So this low-grade inflammation manifests itself in so many disease states. And so as a physician, you inevitably think about, how could we have prevented this?
Right, yeah.
Because, when you come to the hospital with a heart attack, that didn't happen. I mean, it happened yesterday, but the underlying process didn't happen overnight. It happened over many, many years. So what could we as a healthcare system or as a society could have done better to prevent this acute stage? Sure. And the addressing that involves understanding and intervening what's called insulin resistance. And insulin resistance probably is the biggest item, mainly because in America and for the rest of the world to a large extent, we see this a lot more than our ancestors, say, 200 years ago.
Just because easier access to foods, or not moving as much, or what?
Well, that's the million-dollar question. And what happened past 200 years or more, 100 years? More importantly, past 50 to 70 years, because that's when we really start seeing epidemic of many different disease states. So when you look at that, then I think people are realizing that it has a lot to do with what we eat, and also lack of exercise due to modern comfort.
Sure.
But also perhaps environmental toxin. So all those things combined together results in this low-grade inflammation state called insulin resistance. By having to produce a lot more insulin to meet the demand of a main villain called carbohydrate. And but I think there is also that the chemicals like preservatives or other ingredients in processed food also may play a role because we see insulin resistance among the people who eat carbohydrates through processed food than natural carbohydrate.
Sure.
So there are a lot of different factors, um, and we see this that low-grade inflammation being high among people who are sedentary versus who are active. And then inversely, people who exercise can lower the insulin resistance back down to the normal sensitivity.
Really? So it's reversible.
Yes, definitely reversible, but it may not be reversible in later stage of a disease stage such as diabetes.
Oh, I see.
So
Oh.
that's why it's so important to have a preventive strategy. First, to minimize or not having insulin resistant state to begin with, or if you develop disease state like diabetes mellitus, then try to reverse it by implementing lifestyle changes in the early stage. Then we find that many patients may be able to reverse diabetes.
So you're saying like if you just ignore insulin resistance, there's a really good chance that if it continues on, it progresses, it will lead into diabetes or some other like physical ailment.
Yep. So diabetes is kind of an intermediate state to complication state such as a heart attack.
Sure.
So heart attack occurs at higher rate among diabetic patients because the diabetes include certain level of low-grade inflammation, and that damages the inner lining of blood vessels of the heart.
Sure.
And that promotes blood clots within the lumen of the blood vessels. And when that's blocking the blood flow, when that happens in the heart, it's a heart attack.
Yeah, that's
when
not
that
good.
happens in the brain, that's a stroke.
So I'm curious, this is kind of like an aside, but on the biological level, what is actually happening that makes it insulin resistant?
So insulin level tries to meet the demand of, say, carbohydrate in the body. Insulin process the glucose in blood vessel, and it pushes the glucose molecule into the cell, so the cell can use glucose
for energy,
for their energy production.
Okay.
Right? And so when people start eating more than necessary carbohydrate amount, then the glucose level in the blood will go up. So then subsequently, in order to meet that demand, our body produces a higher level of insulin.
Okay.
Right?
Because there's more glucose.
Right. And then subsequently, body gets used to the level of insulin.
Okay.
Then in order to, but body will try to control the glucose level by then producing even higher level of insulin.
Oh.
Because the same amount of insulin is not meeting the demand of glucose level.
Sure.
Right? So if you keep eating and so let's say a person eats candy and chocolate all the time, every day throughout the day, then there is a sustained level of glucose, and to meet that demand, the insulin gets produced all the time.
Interesting.
Body gets used to it, and then the body's not responding to the insulin at the same level. So you need higher level of insulin in order to get the cell to trigger the insulin mechanism. So then higher, and then and higher and higher. If when this happens over many years, then insulin is adipogenic, so it makes more the fat cells. So then people become obese, and when the obesity occurs, that produces a lot of different cytokines that promotes
Interesting.
inflammation.
Wow. And so it's like almost a negative positive feedback loop.
Yes.
Ah.
So then that when the low-grade inflammation continues, then that starts to damage inner lining of the blood vessels. And that promotes the blood clots.
That makes sense.
So that's how what we call big vessel disease, such as a heart attack and stroke.
Not good. So, okay, with that all being said, then how do you, specifically around the insulin resistance, at least, how do you manage it or monitor it or try to make sure it doesn't happen?
Yeah. So so there are different strategies. One is first of all, perhaps we should reduce the amount of glucose being coming into the body.
But donuts are good.
Yes.
Especially
So
from
there are
Sandy's and Fargo.
Some carbohydrate forms are better than the other.
Oh, okay.
We find. So there is something called glycemic index. That the complex carbohydrates may have more sustained level of release, whereas simple sugar like soda, if when you drink it, there is a steep peak of glucose.
Easy to process?
Yeah, easy to process. It comes into
Sure.
the body, so it goes up very fast. And when the level of sugar is high, then your pancreas produces a higher level of insulin, and that's what promotes insulin resistance.
Oh,
So
okay.
one strategy is eating healthy.
Okay.
Yeah. So I think that's a part of the reasons why the new nutritional guideline promotes protein and fat intake over carbohydrate, because our American diet for the past 50 years have been too heavy on carbohydrates.
Sure.
I'm not saying that all carbohydrates are bad, but certainly we've been having too much carbohydrate.
Not
in
enough
the
protein.
past. Yeah, not enough protein. And then the other component is exercise. So when you exercise, our muscles are big utilizer of carbohydrate,
Yep.
right? Glucose. So when you exercise, you can lower the blood sugar. Then you don't require as much insulin.
Oh,
So
sure.
insulin sensitivity or insulin resistance goes down
From exercise?
From
Really?
exercise.
Okay. Good to know.
Yeah. And also, there are other factors that can influence insulin resistance, such as sleep.
And
So-
positively?
Yes.
Okay.
So we find that there were many different studies of people who are not sleeping well, or night shift workers,
Yeah.
who tend to have a higher insulin resistance. And then insulin resistance improves when they are sleeping better.
Interesting. Have you seen anything around like biphasic or polyphasic sleep and that effect on insulin or no?
I'm not sure if the different phasic states are affecting the
Okay.
insulin resistance, but when people are not sleeping when they should, that certainly affects the insulin.
Interesting.
Glucose metabolism and insulin resistance.
I remember, unfortunately, yeah, of knowing of someone that they tried hard to lose weight and combat that, and they really never couldn't, but I knew that they were a night owl and they didn't have like a consistent sleep schedule.
Yeah.
And so maybe that's a big part of it probably.
Yeah. Yeah.
Yeah. So with all that, I guess what would be how can you envision as a practicing clinician in obesity medicine,
Mm-hmm.
what are ways that you are seeing or even ideas people could use AI to help with insulin resistance, if there's even possibilities of that?
Yeah, I think AI opens up really amazing possibility in managing, implementing preventive strategy.
Mm.
One aspect is education.
Okay. Oh,
I
sure.
think
Yeah.
AI contains a higher level of knowledge than other computer system,
Yeah.
and we can now converse.
Mm.
So I think a patient education can be improved with AI because one of the big item that is missing in our current healthcare system is because the corporatization of a medicine resulted in productivity gain
Yeah.
among healthcare workers. So physicians now are measured by how many patients they see in a day
Sure.
and
Sure.
processes. So then physicians, with a 15-minute visit, um, they may not be able to give as much education to the patient as possible. That gap, I think, can be met
Mm.
by conversing with AI agent who um, contain a lot of medical knowledge, which they
Okay.
do.
Sure. Right. Right.
So then, with under healthcare provider supervision, if they can, the program can be created where, okay, with this patient, let us go through comprehensive diabetic education, and then identify, because an AI agent can be very good at generating quizzes
Very
too,
good.
right?
Very good.
So generate quizzes and identify the gap in patients' knowledge.
And help them with that.
Yeah, and then help with
Sure.
them by
Sure.
repeating that point over the different weeks and months. And AI can spend more time, much more time than healthcare providers on that
Mm.
educational effort,
Sure.
right?
I suppose then too, you could even give it more specific diagnostics, saying, "Hey, this is my glucose level today. What should I do?" Right?
Exactly. Yep. I think a lot of times I see patients having difficult time
Mm-hmm.
what to do with the glucose number that they get from blood
Okay.
glucose testing.
Sure.
And
I don't know
if
what it
they are
means.
on, right, if they are on insulin especially, what should I do? And I think once AI program can be developed under healthcare facility supervision, um, the patient can be educated as to what medication does, what's the
Mm.
insulin action, and what's different formulation of insulin, because there are long-acting, short-acting,
Sure.
intermediate,
Sure.
um, and their characteristics and their half-life or pharmacodynamics. Then patient can be understanding better of what their medications are doing to their diabetes. Then when there is the blood sugar is high or low, what should I do at this point? With okay, it's low, then take some sugar, but that's a temporary measure. Perhaps the insulin then subsequently should be decreased so that the low blood sugar is not induced. And the AI also can monitor continuously, frequently, how patients are doing.
Sure.
So let's say a patient is on diabetic medication, but for some reason he or she is not eating very well. Then AI can detect that and advise, oh, maybe you're not eating much. and you've been taking same insulin,
Right.
then perhaps we should monitor your blood sugar more frequently and make sure it doesn't go down too low.
That makes sense.
So because of AI's level of knowledge and intelligence of analyzing the situation, I think AI can help people with diabetes and also people who are trying to lose weight or trying to be healthy. A great service.
Yeah, well, that's excellent. And then also too, like, you can ask it questions as much as you want, and they won't scold you for forgetting.
Yeah, no.
or
right. Yeah.
or being not remembering. Yeah,
Yeah, and AI tend to have a very good bedside manner.
they do. Yeah,
So
you could make them not, but most people would prefer that.
right. I mean, some people may prefer sarcastic
Sarcastic,
approach.
right? Yeah.
Then AI can be made to be sarcastic. So
Yeah. Most people don't. But
yeah.
Well, thanks for your time. I appreciate you answering these questions, and thanks for your insights as to insulin resistance.
Oh, thank you for having me.